All right, Dr. Sam is up here with us, Discovery Medical Center down on Pratt Avenue, 5 Points, basically.
Yeah.
Met Dr. Sam a couple of weeks ago. Coming up tomorrow, I will be doing stem cell to give me relief in my aching knees. And I'm not alone in America, am I, Dr. Sam?
No. Arthritis is probably one of the most prevalent conditions in America.
Now, everybody knows I've had a knee replacement. TLC did a great job on that. But the other one, a lot of people try to prevent having that. So they wear braces and everything. Stem cell, when did that become such a hot subject?
Probably after 2007. In 2007, there were some legal changes that allowed research to be done. What most people may think that it was outlawed, it wasn't ever outlawed. Research was outlawed. And so, or it wasn't government funded. So in 2007, they changed the laws and allowed research to happen, and it's kind of exploded after that.
Now, you've had stem cell yourself.
Yes, sir.
And you've had a shot in your shoulder.
I had a shot in my shoulder, a shot in both hands.
Now, why did you do your hands? Explain why you did it.
Well, my hands had gotten bad. To be honest, I don't do any of the stem cell injections.
Right.
We have a medical doctor on our staff that does all that. I was actually a chiropractor before. After years of using my hands all day, my thumbs had become arthritic, and it was very hard for me to work. So had the stem cell shots in both hands, and about 8 weeks I was pain-free and had all my function
move your
back.
thumbs again.
Yeah, I couldn't put my pinkies to my thumbs because of the pain.
Now, is stem cell a one-time only thing?
Typically.
Or do you have to do it every year?
No, typically. The problem is we try to get people before they've gotten too bad, So I can't, it's case by case, but most of the time, it's one shot only.
All right. I want to mention this now. The reason I have this Superman shirt on today is, and you're welcome to use what I'm about to say.
Okay.
You know who Dean Cain is?
Yeah.
Dean Cain, just this week, had a stem cell shot in Hollywood. He played Superman with Terry Hatcher for a 4 or 5 year series. They had like 15 million viewers a night. Now I see him on Hallmark. But Dean Cain had this shot done. He had a knee injury. He's 54 years old, I think. $10,000 a pop. Of course, that's Hollywood.
Hollywood has Hollywood prices.
Right.
But that's what he had to. So he's played Superman, so I figured it's only appropriate that I, too, wear my Superman shirt in here today.
So silly.
All right. When we first met you, Kobe took an x-ray of my knee and said that I was a prime candidate. You came in and went through the whole thing. What makes me the super athlete I once thought I was, and super stud muffin now on local television, but and longest person ever to be on TV in North Alabama, I might add, Joseph Stott. What makes me such a prime candidate for stem cell?
Well, other than having arthritis in your knee, you're in good shape. Not everybody comes in is in good shape, but a lot of times because their knees or whatever is so bad they can't be active. The fact that you're pretty active still helps us or makes us believe you'll have a really good result.
Because once you get it done, you need to be moving. You need to be functioning.
The whole point of this is so you can get your function back, your life back.
All right. Thanks to Jonathan and all the guys, Jason and all the guys at B&B Medical.
Hal.
Now, Hal Medical, well, the B&B is their other name too, but Hal Medical, and you have braces too. They measured me yesterday, went to Pulaski, their home office now, and got me these 2 brand new braces. What is the purpose of wearing these braces, Dr. Sam, after you've had stem cell shot?
Well, not everyone needs them, but a lot of people do. Some of the purpose is to offload the joint. So you just want to take pressure off the knee so that when you're walking, running, whatever you're doing, you're not getting this compressive force. So we want to put the fluid in there, and we want to keep it in there as long as possible. We don't want to compress it out. So we just want to keep the knee and kind of it's distracted a little bit while you're walking and moving. It's kind of almost the same principle as being in water. You're moving through water, you're still moving, but you're not have all the gravity on you. So we just want to take gravity off that knee for a little while.
So how does the stem cell work? You inject it, and then what does it do?
So the stem cells are a piece of the puzzle. There's a lot of other cells in the tissue. We got growth factors, hyaluronic acid. There's a ton of stuff. So what the stem cells are primary basic building blocks of cells. So a stem cell can become another stem cell, or can become cartilage, ligament, tissue.
So you're growing tissue.
It can help you regrow tissue. The whole purpose is to regenerate and regrow new tissue.
Does it work on everyone?
About 97% of the people have,
I have heard nothing but good
we've heard
results
great.
on the people I have called and got a personal, got a testimony for. So good candidates for this are someone exactly like me Stairs are my enemy. Stairs, step downs, stairs, going up to the gym at 360. Those are my enemy. Church. I can do one. Usually I do one at a time. It's the safest because I don't have any range of motion in my new knee because it's just by scar tissue. You can fix that too.
We use certain tissues to help fight scar tissue. So one of the things we're going to do for you, Dr. Cornelius talked and looked at your file, things that we can kind of give you some of the tissues that are very, what they call anti-sclerotic, to help with fight some of the scar tissue you've built up over time.
Now, do you do seminars?
I do.
And this has been going on for a couple of years for you?
We've been doing it for about 2 years. So we have a seminar tonight, which is completely booked up at Catfish Cabin. But then later on this week, because that one booked up, we're going to be holding one in our office on Pratt Avenue.
Now, when you do a seminar, you just go through basically what we're doing right now and then allow people to ask questions?
Yeah.
Is that the way you handle that?
We kind of give a history of us, our office, and then kind of what the stem cells do, kind of who's a good candidate, and then allow for questions.
And yesterday, wasn't it your second-year anniversary?
It was.
All right, congratulations.
Now, does it hurt?
It's a shot, so there's going to be some pain. I don't want to say it's this painless.
Discomfort?
There is going to be some discomfort. It is a needle going in there. Now, depending on what type of tissue we do, there's some tissues that are kind of have an inflammatory reaction. You may be sore afterwards, but most of the time that's not the case.
So within a matter of days, you should, speaking of that, I know a matter of days, all the pain should go away. When do you start knowing the results of stem cell?
It's different. Certain people feel better almost immediately, and other people take several months. So it could take, like I said, 3 days, 3 months. But most people will see results within a month.
All right. I can't bend either one of my knees that good, especially my new one. But I'm in no pain with it whatsoever, what I had up TLC. This one, I'm in constant pain with it. CBD oil is very helpful to sports.
And the reason he wanted to try this is because before the other option is to do a total knee replacement, again, he wanted to check out this option.
Well, the good news on this, is that's our primary candidate too, is someone who's trying to avoid replacement surgery, especially for knees. That's primarily what we see. Knee surgery has its place, but if we can catch them early enough, hopefully we don't have to do that. And so you've had a knee replacement, months of rehab follows like that. Painful rehab, yes, sir.
What rehab goes with this?
It's different per patient, depending on how inactive or how much atrophy is happening. But some patients may need a month of rehab. Some people don't need any.
You don't have to go to rehab, so you just,
not everybody.
You just continue to do what you're doing.
Yeah, some people we recommend rehab, and other people we don't.
All right. After having these shot in each leg coming up tomorrow, what is my best case scenario?
Best case scenario, stairs become your friend again.
That's a good best case scenario.
Good. Yeah, I got a lot of other uses I could use my ride a bike. I can't spin anymore.
Best case scenario, you can go back to living the life and having the function that you had without pain.
Couple things. Insurance doesn't cover this.
No, sir.
Now, is financing available?
We have financing available for people that want this.
What is basically the average cost on a stem cell injection?
Well, depending on what tissues you use, it can go from anywhere from maybe a couple thousand to $3,000 to $4,000 to up to maybe $7,000 or $8,000, depending on what's going on.
Are there still some out there who aren't a believer in the stem cell?
Yeah, there's tons. Any new procedure, and when I say new in medicine, 20 years is new. The first 20 years is relatively new. So any new procedure is people are gonna kind of doubt it.
All right, I've done some research on this, both with Dorian and both of them, but what is the future of stem cells?
Well, we primarily deal with this arthritis and tendonitis, things like that, musculoskeletal complaints, but the future is pretty bright. There's doctors all over the country using it for different things. There's research going on for a host of different diseases and conditions,
One thing I asked Dr. Sam, not after he had gone over that with us before, he goes into it and explains it. Basically, he lays the whole thing out, how the blood is mixed, what it does for you. So we didn't have time for that this morning. So what else do people need to know about Discovery Medical Center?
For a consultation, do they just call your office?
Yeah, you may call our office, 256-533-2900. And then basically, you want to find out if you're a candidate. So in order to do that, consultation, evaluations. There's sometimes imaging. If they have imaging, great, they can bring those along. We may need imaging like an x-ray or an MRI to find out and make sure they're a good candidate. We really only want to see patients that we think would be,
And
good results.
97% approval rating in this.
Most of the time. I think we've done over 100, maybe a little over 100 injections, and I think we've had a little bit better than that. But
Unbelievable.
that's across the country. That's what we look at as everybody else's results too.
I'm telling you right now, we will know the next couple of days after tomorrow how this works, but I am excited about it because my knees are really horrible, at least the one over here that hadn't had a new one yet. Bending, stairs, walking's not really a problem, but I can't do a bicycle, can't exercise to get on my knees and do stuff.
Definitely worth a try.
Can't do any of that. So y'all know what a specimen I am.
Falling apart.
Yeah, evidently. I'm good if I can get my knees going, and that's what Dr. Sam
But
does.
again, you actually did the stem cell in your shoulder and
I
your
did.
hands or your thumbs, and
Yeah, did my thumbs, shoulder, and I just really had a hair treatment to help regrow my hair.
now you just woke a bunch of men up.
Well,
Yeah.
let's talk about that for
And
a second.
possibly women,
I
too.
don't have time to mention that's what we've been talking about.
I knew
I'm
you'd
a
be all
candidate
over
for
that.
If you're bald, it won't work.
Yeah.
But if you've got thinning hair,
yeah.
how long does that take to work?
About 4 to 6 months is typical before you start seeing results. It's more in-depth treatment. You do it once a month for 3
And
months.
it hurts.
Yeah, I ain't gonna lie.
It's another shot.
Well, the head is very tender, okay, and it's very superficial. They're going right under the skin, and so it feels like a sunburn, to be honest. That's what I felt like I had for about 3 days afterwards.
Okay.
And then it does a lot of other things too. So you will need to get in touch with Dr. Sam over there. We'll talk
Interesting.
all about that.
We'll find
I'm
out.
excited. I'm going for it. I'll let y'all know. We'll follow this journey.
Yeah.
Of no pain. Stairs will be my friend again. All of it. If Superman can do it, I can do it.
All right, Bionic.
Thank you, Dr. Sam, for coming up. I'll be seeing you tomorrow.
Thanks, guys.
Toby, you too, over there at Discovery Medical Center, right there in
On Pratt Avenue.
5 Points on Pratt Avenue. We'll come back with Joseph in just a second. Y'all hang on.